Good morning, students. This is a brief overview of Chapter 4, a tutorial video and a quiz to follow on prenatal development and birth. Let's begin with our learning goals and objectives for this chapter. We will summarize the phases of the prenatal period, explain the changes in fetal brain development, discuss abnormal spine development, and we will talk about spina bifida and what that is. Effects of teratogens. We'll explain what teratogens are and how it affects the developing fetus during prenatal development. Effects of radiation during prenatal development. Discuss the mother's state during pregnancy and her experiences and effects on the developing fetus. Discuss the father's state and his experiences during pregnancy, during prenatal development. And we will talk about identifying at-risk newborns, app scoring. We'll talk about various diseases as well. So you learned from genetics about the stages of meiosis and mitosis. And in reproduction, conception begins, as you noted, with the fertilization of the egg by the sperm. So from ovulation to implantation, you can see from day 0 where the egg is released by the ovary and it travels through the fallopian tube. Here where it is fertilized by the sperm, as you can see, and it undergoes the stages of division of mitosis. You can see here, begins to divide, and once it divides again, it is implanted into the uterus and forms a blastocyst by day 7. And it is planted into the walls of the ovaries or the uterus for growth. Now, we're going to talk about the embryonic development of the fetus, and these are known as the prenatal stages. And for testing purposes, you only need to know the names of the periods and the basic events that happens in each period of development. So the first period of prenatal development is the germinal period, which lasts approximately 2 weeks, and is called a zygote. It forms and it divides and forms a hollow ball called a blastocyst. It goes through the stages of mitosis, as you saw in the last slide, and then it plants into the uterus. This is the germinal period. Now, the embryonic period occurs from the 3rd to the 8th week of pregnancy. It is now called an embryo, where the organs begin to form. The ears, the mouth, the heart begins to beat. The brain begins to develop, which you'll see in the next slide. And it looks more like a human starts to take human shape by this time. The fetal period, which lasts from the 9th week of pregnancy until birth, which encompasses part of the first trimester of pregnancy, which is the first 3 months, and all of the 2nd and 3rd trimesters. It is called a critical period of brain development, which you will see in this next slide. So how does the nervous system develop and the fetal brain develop? Well, the fetal brain undergoes several changes at various stages of prenatal development. And as you can see, the nervous system begins and emerges from a neural plate. And it thickens and it folds to form what is called a neural groove in the middle. Now, when the edges of the groove meet, the neural tube is formed, and all of this takes place between 18 and 20 days after conception. And as you can see, at various stages of the 9-month period, it goes through these various stages: the hindbrain, the midbrain, the forebrain. And by the time it reaches full birth, the brain is fully developed. You can see the development of the neural tube at 21 days, 22 days, and by 28 days, it is fully formed. And if it's not closed and formed properly, a disease called spina bifida develops. So you see this opening, you'll see more in the next slide. So, spina bifida, unlike the normal spine, as you see in this picture, spina bifida is characterized by an opening, a relative small, and it's invisible, which is illustrated here, and it may be large enough to allow part of the spinal cord and nerves, as you can see in this middle diagram, to bulge out of the spinal column. And the problems such as ancephaly, which is a failure to close at the top of the neural tube, as you see here, which can cause serious side effects. And all of this takes place 26 days after conception. And it's usually caused if the mother is deficient in a type of vitamin B called folate. So it's important that the mother takes her vitamins during pregnancy. Now, in this photo, we can see what the baby or the fetus looks like at 10 months after it is conceived. On the right, you see the baby bump, what we call it, and it's barely visible on the mother in some, in spite of what is going on in the inside. This is what the baby actually looks like, in spite of the changes that are taking place inside. What is the age of viability? Well, at 24 weeks of gestation, the fetus has reached a point where it may be able to survive outside of the womb if it is born early. However, if the baby is born too early, there's no chance of survival. But if the baby is born at 24 weeks, it will be placed in the neonatal intensive care unit, where it will be monitored for several weeks and months until it becomes healthy enough to survive outside and go home with the mother. Now, the obstetrician can take 3D images of the baby during ultrasound. This is a 3D ultrasound. This is an actual photo of this baby inside of the womb. And it looks almost similar to those, just like the baby after birth. Now they can do 4D ultrasounds to see even more pictures. And during the ultrasound, they can determine the sex of the baby. This photo shows an illustration of what is called sensitive or critical periods during development. This is the period of time that if the mother are exposed to teratogens, which are substances that can harm the developing fetus if she is exposed, can cause a lot of structural abnormalities during the 3rd through the 8th prenatal development. Of course, many of the organs and the body parts are very sensitive to teratogen agencies throughout the 9-month period of development. So it's very important that the mother is very careful about what she ingests during pregnancy. Teratogens such as streptomycin, which is an antibiotic, quinine, can cause damage to the 8th cranial nerve, which helps a baby develop hearing. So this can lead to poor hearing and deafness. Tetracycline is another antibiotic which can cause staining of the tooth enamel and inhibit the growth or prevent the growth of the long bones in the baby. Vitamin K can lead to destruction of red blood cells. Iodides can cause goiters and which is an enlargement of the thyroid gland. And you've seen large nodules on people on their necks. Thalidomide, which is the absence of extremities. Some babies are born with no arms, no legs, toes, and they learn to function. They usually with some type of prosthetic. And you'll see a picture of this in the next slide as well. Steroids can cause cleft lip, cleft palate, and can even cause the mother to have abortions or miscarriage. Lithium, which is a psychotropic drug, can cause congenital malformations. The right heart defects. A lot of babies are born with holes in their heart and usually have to undergo surgery. Some have poor valve development. Dilantin, which is an epileptic drug that individuals are given for seizures, can cause craniofacial deformations. Microcephaly, which is a very small head. Nail hyplasia and heart defects as well. And of course, its last one, isotretinoin, known as Accutane, can cause congenital deafness as well, and can also cause severe central nervous system defects. So the mother has to be very careful about that. Of course, we know that if the mother smokes during pregnancy, it can also cause serious effects of the baby. It can cause problems with the hypothalamus. They can have nicotine withdrawal at birth. They can have slow birth growth, obesity, and diabetes at adulthood. And of course, it can cause increased brain serotonin and dopamine. Here says it can lead to one developing more preference for junk food. So smoking is very important. Drinking is also very serious. So mothers should not drink either from pregnancy. Down syndrome, which is also a congenital defect. Clinical features here, we see that they have flat face, profile, slanted eyes, short necks, abnormal shaped ears, white spots on the iris of the eyes. These are called Brushville spots. And they can have a deep transverse crease in the palm of their hand. And the genetics of Down syndrome, as you learn your genetics, part of a regular cell showing chromosomes 18, 19, 20, and 21. These are normal. But in the Down syndrome child, you have part of a Down syndrome cell showing the 21st pair of the chromosome with one extra chromosome. Here is that extra chromosome on the 21st pair. There are other diseases that can affect the fetus during prenatal development as well, such as rubella, commonly known as German measles. A long time ago, people, if they got German measles, it would cause the fetus to have heart defects after birth. The baby could be born blind, could also be born deaf, and could develop learning or intellectual disabilities. Now, when the infants are born, they are vaccinated with the German measles vaccination. Diabetes, commonly known as gestational diabetes during pregnancy. This is where the mother develops diabetes during pregnancy, which is elevated blood pressure. No, elevated blood glucose levels, which can cause one to have premature delivery, stillbirth, or miscarriage, immature lung development, as well as large fetal size, oversized babies at birth. Sexually transmitted diseases such as syphilis and AIDS are very serious. Of course, syphilis can cause the mother to have a miscarriage. The baby can be stillborn, but this is only in 6% of the cases where the mother is infected. But if the mother is treated for syphilis during pregnancy, the baby has more of a chance of survival. eggs also destroy the immune system and can make them more susceptible to infections and can transmit the virus to the fetus through the umbilical cord. And it can also cause the placenta to separate before birth. So this is very serious. And of course, diabetes, sexually transmitted diseases, or any disease that the mother may have that is pre-existing can cause the mother to become a high risk and must be treated with special procedures during pregnancy. And finally, we will talk about at-risk newborns. And at-risk newborns are newborns who are not exhibiting 100% characteristics as the newborn should at birth. So APGAR stands for activity, pulse, grimace, appearance, respiration. And each of these characteristics are scored from 0 to 2, with 2 being the highest in all categories. And the activity, they're looking for the muscle tone to see if they're looking at the reflex. Pulse, they're looking at the heart rate. If the baby has a very weak heart rate or extremely high heart rate. They're looking at reflex response. If they tap the baby, how the baby responds. The appearance of the baby, their skin color. Are they cyanotic, bluish looking, grayish looking, or if they have a pinkish normal skin color. And they're also checking for respiration, the breathing. Do they have very low breathing? Do they cry and breathe? Or are they crying strong and have a regular breathing pattern? And they are given a number in each category, and these numbers are added up. And if the infant has an extremely low APGAR score, then the baby is not considered to be 100% healthy. Therefore, that infant will be placed in the neonatal intensive care unit and monitored until the baby becomes healthy enough to go home. So this is just a brief tutorial, and following this video, you are to complete your 10 questions, which is a multiple choice quiz.